I am Dr. Meenu Handa, Clinical Director for IVF and Fertility Services at Cloud9 Hospital, Gurgaon, Delhi, in India. So we specialize in providing a high-end technology along with personalized care to every couple who is finding difficulty to get pregnant. So hello friends, today we shall discuss about various genetic diseases and genetic testing on the embryos. Many times we get a lot of queries with couples having some genetic issue or a previously affected child, that whether we are able to help them or not. So many couples, when they come with this problem, with a particular genetic disorder either running in the family, it's very, very disheartening and sad that they have experienced this kind of a problem. But before we look into the solution, let's understand what is a gene. So genes are nothing but packets of information that is inherited from the mother and the father to the child. So many times these genes are the building blocks of our life. That means all of us require properly functioning gene because they help us in overall functioning of the organs, of various other structures, and so that it helps for an individual to have a very healthy life. Now many times what happens is that there could be certain error either in the structure of the gene or the number of genes that are presented or the number of copies that are presented in the gene. Sometimes, or there could be an error in the shape of the gene. It could be inverted, or at times it is translocated, means it should be in a particular position but it is not in that set position. It has translocated to another site. So all of these errors of the gene, which we call in the scientific term, we call it as a mutation. So that is what, whenever we talk about a gene mutation, in a very simpler manner to tell you, to make you understand, it is called as an error. So now what happens is that many people could be, or a person is having a genetic mutation but not having a disease. They are called as carriers. So look wise and functioning wise, they're all fine, they're normal, but they are actually carrying the mutation of the disease. These people are called carriers. So when a carrier marries a carrier of the same disease, there is a possibility that their child could have the disease. Now I'll explain you with a little example. Now for example, there is a disease called cystic fibrosis. Now in cystic fibrosis, if the mother is a carrier of that disease and the father is also the carrier of that particular disease, then there is a 25% chance that the children can inherit the disease from the overall healthy parents. So parent is not having the disease, but because they both are carrier, there is a 25% risk that their children could have the disease. So now that becomes a very complicated issue to handle. So it is very important that those diseases should be identified and a genetic screening should be done and a proper investigations and thorough counseling should be done with the help of a geneticist. So all those couples who have or they know that there is a genetic problem running in the family and they are carriers of a certain disease, or at times, which is a very sad thing, that they're absolutely normal and they have a affected child by a certain disease. All such couples should get themselves examined and do a thorough genetic screening, and a geneticist should be on board, and that is how you should plan your future pregnancies. So what is the solution? Many times when the genetic screening has been done and a geneticist has pinpointed what a disease is and whether that disease can be helped by doing an embryo biopsy, that is something that a geneticist will always tell the clinician. So in certain cases where it can be helped, that is a time when an IVF is done to the couple, and in IVF the eggs are collected from the wife, the sperms are injected from the husband, and the resulting embryos are then grown in the lab and they are genetically tested. This is a technology which is called as a PGT-M, that is pre-implantation genetic testing for monogenic. M stands for monogenic disorders. Now this is very important, that what happens is that only the normal embryos, the reports will come and only the normal embryos who do not have that particular mutation are then transferred back to the woman's uterus. So in that ways, what happens is that there is a 20% increase in the success rate and chance of having a normal baby not carrying the disease of cystic fibrosis or thalassemia or whatever. Now, there are hundreds of diseases that can be identified by PGT-M, and the couples can be given some ray of hope. Now, some of the genetic disorders where PGT-M can help are like cystic fibrosis, blood disorders like thalassemia, sickle cell disorders, some muscular disease known as Duchenne muscular dystrophy, and certain kidney diseases like the autosomal dominant polycystic kidney disease. So a lot of diseases are now identified and a screening tool is available. So friends, today I hope we have understood that what are the genetic problems, what do you mean by a mutation, and what do you mean by carriers, and how PGT-M or the biopsy on the embryos can actually free a family of a genetic disorder. For any other further queries, or if you have any personal assistance that you will require, you can all connect to our team and we shall get